Did you know that in 2025 so far, there have already been 374 million healthcare records exposed due to That's more than 1 million records every single week. And this number is only expected to grow. In today's video, we dive in deep into the shocking world of cybercrime, and I'll challenge myself to find out how healthcare systems are being targeted in 2025. From data breaches to ransomware attacks, we'll see what's really happening behind the scenes and the impact it's having on patients like you and me. Get ready to be shocked, surprised, and informed as I uncover the latest cyber threats and what you can do to protect yourself. Hey, I'm here. Welcome back to my channel, where I bring you all the latest news and updates about cybersecurity, technology, and a whole lot more. But before we start, make sure to hit that subscribe button so you never miss out on any of my exciting videos. Alright, let's dive in. The healthcare industry has seen a huge rise in cyber attacks in recent years. And it's no surprise why. With patient data being one of the most valuable commodities on the black market, it's a goldmine for cybercriminals looking to make a quick buck. These attacks are not only costly for the organizations affected, but they also put patient safety and privacy at risk. The FBI and CISA recently issued an alert about this exact issue, warning of increased cyber threats against the healthcare and public health sector. In fact, in the first half of 2023 alone, the FBI received over 2,000 cybercrime complaints from healthcare entities, double the amount compared to the previous year. It's clear that something needs to be done to protect these critical organizations from these malicious actors. So let's take a closer look at the problem. Ransomware attacks on hospitals are becoming more common, with cybercriminals targeting vulnerable systems and demanding hefty ransoms for the return of vital data. The human element is often the weakest link in cybersecurity, and many organizations are still lacking in proper training and awareness programs. As the demand for healthcare services continues to rise, it puts pressure on IT staff who may be tempted to cut corners, which leaves them more vulnerable to attack. Now I want to talk about the cost of cybercrime against healthcare organizations. It's staggering. In 2020 alone, healthcare organizations suffered a whopping $8.4 billion loss due to cybercrime incidents. That's $8.4 billion with a B. And the sad part is that these numbers are only expected to grow. But the question is why? Why is the healthcare industry such a prime target for cybercriminals? Well, it's simple really. Healthcare organizations have a ton of valuable data that can be sold on the black market for a pretty penny. We're talking about patient data, financial records, and even proprietary research data that can be used to develop new drugs and treatments. The potential profit is just too much for cybercriminals to resist. But it's not just the financial incentive that makes the healthcare industry a prime target. It's also the fact that many healthcare organizations are simply unprepared for cyber attacks. They may not have the necessary security measures in place to protect their data from being stolen, or they may not have a plan in place to recover quickly from an attack. This leaves them vulnerable to the type of attacks that we're seeing more of today, such as ransomware attacks. These attacks can be devastating for healthcare organizations, not only because they can result in the theft of sensitive data, but also because they can disrupt critical operations. Imagine if you were in the middle of an emergency surgery and the hospital's computer system suddenly went down. It would be a nightmare scenario, and it's exactly what ransomware attacks can cause. But the good news is that there are things that can be done to mitigate the risk of cyber attacks in the healthcare industry. One of the most important things is to raise awareness among staff members about the importance of cybersecurity. Many attacks happen because staff members don't realize that they're being targeted by cyber criminals. They need to be trained on how to identify suspicious emails, how to use passwords correctly, and how to report any security threats they may encounter. Another important step is to implement strong cybersecurity measures. This includes things like encrypting sensitive data, using multi-factor authentication, and regularly backing up data to ensure that it can be recovered quickly if needed. By taking these steps, healthcare organizations can better protect themselves from the growing threat of cyber attacks. And while some organizations are making progress, there's still a long way to go. The healthcare industry is still struggling to keep up with the rapidly evolving threat landscape, and the result is alarming. Let us take a look at some of the recent attacks that have occurred and the impact they've had. The rise of cybercrime in healthcare is a serious concern, and the numbers speak for themselves. In the United States alone, between January and June 2023, there were 416 reported data breaches in the healthcare sector, exposing over 374 million patient records. This staggering figure represents a 41% increase in data breaches compared to the same period last year. It's important to note that these numbers only reflect reported incidents, and the actual number of attacks is likely much higher. The majority of these attacks were financially motivated, with cybercriminals targeting sensitive patient data, such as social security numbers and insurance information. These details can be used for identity theft and other fraudulent activities, resulting in significant financial losses for both patients and healthcare providers. The impact of cybercrime on the healthcare industry goes beyond financial losses. it also poses a serious threat to patient safety and well-being. For example, a ransomware attack on a hospital's computer system could prevent doctors from accessing critical patient records, delaying diagnosis and treatment. Additionally, the theft of patient data can lead to medical identity theft, which occurs when criminals use stolen medical information to obtain healthcare services or insurance benefits fraudulently. This can result in patients receiving unnecessary medical procedures or treatments, leading to potential harm. Despite the severity of these issues, many healthcare organizations are still unprepared to deal with cyber threats. A recent survey found that 64% of healthcare organizations experienced a shortage of cybersecurity professionals, while 43% cited a lack of funding for security solutions as a major obstacle. Now, let's move on to the next segment. Now that we've established the scope of the problem, let us shift our attention to the key players involved in the cybercrime ecosystem that targets the healthcare industry. At the forefront of this landscape, we find the cybercriminal organizations. These groups are highly sophisticated and operate with the same level of professionalism as legitimate businesses. They have clearly defined roles and responsibilities within their teams, which include specialists in areas such as malware development, network infiltration, and data encryption. What sets them apart is their use of advanced hacking techniques and their willingness to exploit vulnerabilities in healthcare systems to steal valuable data or disrupt critical operations. But cybercriminal organizations aren't acting alone. They're often supported by a network of accomplices who play a crucial role in facilitating their activities. These accomplices range from individuals who have gained access to sensitive data through their employment in healthcare settings to insiders who intentionally provide access to facilitate. They may be motivated by financial gain, personal vendettas, or even political agendas. To understand the motivations and methods of these actors, it's essential to delve into their backgrounds and explore the factors that drive their behavior. Some of these actors may be highly skilled individuals who have developed expertise in cybersecurity and exploit their knowledge for personal gain. Others may be part of organized crime rings that have shifted their focus from traditional criminal activities to cybercrime, due to the higher potential for profit and lower risk of detection. As the healthcare industry becomes an increasingly lucrative target for cybercriminals, it's crucial to stay vigilant and proactive in protecting against these evolving threats. Alright, now that we've covered the basics, let us dive deeper into the tactics and techniques used by these cybercriminals to infiltrate healthcare systems. One common approach is through phishing attacks, which involve sending emails that appear to come from legitimate sources but contain malicious attachments or links. These attacks aim to trick unsuspecting victims into opening the emails and clicking on the links, which can then install malware on their systems or grant hackers access to their networks. Another tactic is through social engineering, where attackers impersonate authorized personnel to gain access to sensitive information or systems. This can involve posing as IT staff members requesting remote access to a system, or as a high-level executive, directing employees to divulge confidential information. Once inside the system, attackers may use various methods to maintain access, such as by installing keyloggers to capture login credentials or setting up to bypass security protocols. To truly appreciate the complexity and sophistication of these attacks, it's important to examine real-world examples that have occurred in the healthcare industry. Take, for instance, the case of Universal Health Services, a large healthcare provider that was hit by a ransomware attack in 2016. The attack resulted in the theft of approximately 60 gigabytes of data and forced the company to pay a ransom of $11 million to regain access to their data. This incident highlighted the vulnerability of healthcare organizations to cyber attacks and the significant financial impact they can suffer as a result. Similarly, the 2017 WannaCry ransomware attack affected numerous organizations worldwide, including the National Health Service in the UK. The attack caused widespread disruption to healthcare services, resulting in the cancellation of thousands of appointments and the diversion of patients to other facilities. This incident demonstrated the potential for cyber attacks to not only compromise sensitive data, but also to disrupt critical infrastructure and impact the delivery of essential services. Now let's talk about the motivations behind these attacks. Financial gain is a primary driver for many cybercriminals who target healthcare organizations. The value of patient data on the black market is substantial, with a single database containing millions of records selling for up to $2,500 per record. The healthcare industry is attractive to cybercriminals due to the abundance of sensitive data and the perceived vulnerability of healthcare systems. Patient data such as social security numbers and insurance information is highly sought after by criminals who can use it for identity, theft, and other fraudulent activities. Beyond financial motives, some cybercriminals are driven by political or ideological agendas. Activist groups, for example, may target healthcare organizations to disrupt essential services or to make a statement about a particular political issue. In some cases, cyber attacks on healthcare organizations may be carried out by disgruntled employees or former employees, seeking revenge, or by foreign nation-state actors seeking to gain a strategic advantage. Now let's explore the legal and ethical implications of these attacks. The unauthorized access, use, or disclosure of protected health information is a violation of federal law under the Health Insurance Portability and Accountability Act of 1996. Additionally, the Computer Fraud and Abuse Act makes it a federal crime to intentionally access a computer system without authorization or to exceed authorized access. These laws aim to protect both patient privacy and the integrity of healthcare systems. However, enforcing these laws can be challenging, as cybercriminals often operate across international borders and use sophisticated methods to conceal their activities. International cooperation and collaboration are essential to effectively address this issue. Now that we've covered the motivations, let's discuss the impact of these attacks on a global scale. The healthcare industry is a critical component of any society, and the disruption of its services can have severe consequences. Ransomware attacks on hospitals, for example, can prevent doctors from accessing patient records, delaying diagnosis and treatment, and potentially endangering lives. Moreover, the theft of patient data can have far-reaching implications. When large databases of patient information are leaked, individuals may face a lifetime of dealing with the consequences of identity theft, such as obtaining new financial accounts and monitoring credit reports. The reputational damage to healthcare organizations from data breaches can be severe, leading to decreased trust and potentially affecting patient care. Addressing this issue requires a multi-pronged approach involving government agencies, healthcare providers, and individuals. Implementing robust cybersecurity measures, promoting international cooperation, and educating individuals about online safety are all crucial steps in mitigating the risks of cyber attacks. Let's conclude by summarizing the key takeaways from our discussion. The healthcare industry faces significant threats from cybercriminals due to the value of patient data and the vulnerability of healthcare systems. Attacks can result in financial losses, service disruptions, and reputational damage. Understanding the motivations and tactics of cybercriminals is essential for developing effective defense strategies. Legal and ethical implications of cyber attacks in the healthcare industry must be considered and addressed through international cooperation. Protecting the healthcare industry from cyber threats is not just a technological challenge, but a shared responsibility that requires a collaborative effort from all stakeholders. Now, I want to hear from you. What are your thoughts on the rising threat of cybercrime against the healthcare industry? Leave a comment below and let me know. And if you want to learn more about cybersecurity, check out this video over here that I think you might find interesting. Don't forget to give this video a thumbs up and share it with your friends. And don't forget to subscribe for more updates. Thanks for watching. I'll see you in the next video.